Hi, my name's Clayton Montgomery. I'm got Dr. Rashmi Hooda. Um, got Dr. Rashmi Hooda with us today, and she has very graciously set aside some time to do this interview with us, and we're really excited to have her. First, Dr. Hooda, I just want to ask you a little bit about your practice here in Milledgeville, Georgia. Just if you'll just tell us a little bit about your practice.
Sure. I've been in practice about 10 years, and basically I have an internal medicine practice, which includes a lot of different types of patients, but we do have a lot of elderly patients, a lot of patients with diabetes, high blood pressure, congestive heart failure, and COPD. So sometimes these patients do get sick and they do need some help at home because they don't always have family members there available to help them. So that's why I think having a good, home health agency in the community is important.
Okay. Well, thank you. What is the first thing that comes to your mind when you think of home care, home health care?
I think of that as a bridge between the patient and me. When they can't get to me, obviously I can't be with them 24 hours. It's somebody who can communicate, who knows more than the patient knows, can help them, whether it's just we're trying to monitor their vitals or physical therapy, basically improve the patient's health,
Right.
And well-being, and make them more independent,
Right.
and keep them out of the hospital,
Right.
hopefully.
Right. Exactly. Um, what would you say that you like the most about using Care South for your home care needs?
What I like, of course, they have very friendly staff. That's number one. The way they communicate with our office is wonderful. The way they communicate with the patients, they really like them. And if there is a problem, they'll come to us directly. They won't wait. And just very easy to work with.
Mm-hmm.
And they get the job done. They really help me and my patients. They help me take better care of my patients. And I just think it's a great resource in the community.
I hate to put you on the spot real quick. Is there an example that you can give us of where you've seen, or a good story that you have about a patient who's been under home health, or is that you've used or prescribed home health for the patient, and you've seen just the great benefit from using it?
Absolutely. I have an elderly man, and he does have a history of heart failure, and his blood pressure does go up and down, and retains fluid, and he gets pneumonia. And we've had a home health nurse come out and check his vitals, and examine him, listen to his lungs. And when she feels like there's a change, she will call me that day, and the patient will either come in that day to the office, or the next day I can adjust his meds so he gets better, so he doesn't end up in the emergency room, which I think is success.
Mm-hmm. Thanks again for sparing some time for us today, Dr. Huda. We're so grateful
Thank
for
you. No
you,
problem. I
and
appreciate it.
and grateful for your time and your loyalty to Care South. We
You're more
appreciate
than
you.
welcome.
Thank you.
Thank you.